name is Michael Stoffman. I'm a neurosurgeon at Niagara Falls Memorial Medical Center. I grew up in London, Ontario, only a few hours away from beautiful Niagara Falls, and I've lived in Buffalo for the last 15 years. I was educated mostly in Canada, but I did my neurosurgery training at Yale University in New Haven, Connecticut. When I finished my neurosurgery residency and was the chief resident in New Haven, I came to Western New York, and I had been working, as I said, in Niagara Falls at Niagara Falls Memorial Medical Center since 2006. My practice is mostly dedicated to minimally invasive spine surgery. Many people have asked me recently, and when I first moved to Western New York, why did I choose to work at Niagara Falls Memorial? And that is a great question, and the reason is that I initially always believed in the people of the hospital. I was impressed by the mission of the hospital and the administration and the leadership of the hospital. I was impressed that whenever they said that they would get a specific piece of equipment for me, they would actually do it right away. And then over the last 15 years, we have built beautiful operating rooms that are modern with some of the best equipment that money can buy. And we have also been able to work with fantastic anesthesiologists who are part of the Great Lakes Anesthesiology Group. And now with my anesthesia partners, we are able to do surgeries and get people in and out of the hospital very quickly. So for example, when I was a resident, patients who needed fusion surgeries of their spine would often be in the hospital for at least 5 to 7 days. As my residency progressed and we started to adapt more minimally invasive procedures, we were able to shorten the hospital stays. And when I started doing these procedures in Niagara Falls and Western New York 15 years ago, most patients were staying 1 to 2 days. But with our newer anesthetic techniques, we're now able to send many patients home the same day of surgery. Why is this important? People recover faster at home. People are more comfortable in their own bed. People are more comfortable and safer, frankly, getting to and from the bathroom in their own home. So I was attracted to neurosurgery because of the tremendous effect I realized I could have on people's lives. When I was a medical student, I spent a lot of time watching and observing the neurosurgeons, and I was always amazed to see patients come in with fairly complicated problems, and after talking to patients, examining them, reviewing their imaging, coming up with a plan that would actually help them. And then we would see these patients afterwards, and they were better. And just that appreciation that the patients had for what the surgeons had tried to do was really an incredible experience, and that's really why I chose the field. I've had this discussion many times with people about the fear of surgery, and obviously what I tell people is I worry about the people that aren't worried about having neurosurgery or spine surgery. It's normal to worry. This is a serious type of surgery to have, and I think it's important to recognize that we have a lot of tools, a lot of resources available to do these things safely. That being said, I've been in the hospital almost every day in the last month. The doctors and the nurses and the cleaning staff are all doing an incredible job wearing the masks, using hand sanitizer, making sure everything is absolutely as clean as possible,